I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It, episode 59. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Hey folks, Dr. Joe here. So glad we could spend a little time together. The fun show. It's a weird show. The topic is, as I put together my shows, I always try to come up with some creative little topic. And heart disease is such a big issue. My father died of it. I'm sure you've been affected by someone with heart disease in your life. And what I've noticed, been in practice for well over 3 decades now, is what I'm noticing is that more and more diseases that we didn't see in younger people are now appearing in younger people. And so the topic came to my mind, heart disease, it's not just for old people anymore. And there's a lot of profundity to that because we are seeing these problems with younger and younger people. Strokes, I get calls all the time from you, the listener, saying, listen, Dr. Joe, I had a stroke. How old are you? I'm 30, I'm 32, I'm 35. What? No, strokes are for old people. It's not for young people. So the problem is, we're going to talk about heart disease and stroke and heart of the arteries and cholesterol and what really causes that heart of the arteries to form. You need to learn this because it's really important. And the reason this tied in with me is so many people, when I do other shows, I know, sorry folks, I do cheat on you, I do other shows. And some of those shows are call-in, and I get the call a lot on the ketogenic diet. You know, eat a lot of fat. And if you eat a lot of fat, you're going to be fine and you're going to lose weight, you're going to live forever. It's not true. Studies now are coming out that the ketogenic diet, if you do it for more than 2 months at a time, if you do it long-term, you can increase your risk of heart disease by over 30%. And one of the reasons is that when fat, there's good fats and there's bad fats. And we came up years ago with the statin drug to help lower your cholesterol, and that was the miracle drug, and it was going to solve all the problems because cholesterol in the blood was the problem. And there's high-density lipoproteins and low-density lipoproteins. And the high-density lipoproteins are the good cholesterol, and the low-density lipoproteins are the bad cholesterol, generally speaking, okay? So we came up with this thing. Cardiovascular disease is still the leading killer in the United States. Maybe it didn't work as well as we thought it would, and it didn't, okay? So I understand the concept of lowering cholesterol, but no one ever tells you why. And that's why you listen to the Dr. Joe Show, because we give you the why. And I give you logic, so hopefully you can't argue with me. So what happens is a person eats a meal containing things called polyunsaturated fats, things like corn oil, soy oil. We were taught that the saturated fats were bad and the unsaturated fats were good, and the polyunsaturated fats were even better. But the polyunsaturated fats are not very stable. What that means is they're very susceptible to breaking down and doing something called oxidizing. And when a polyunsaturated fat oxidizes, that's when it starts to cause its problems. The other concern I have with these vegetable oils, corn oil, soy oil, canola oil, many times they're made with genetically modified foods, and that concerns me a lot. Because the GMOs, the genetically modified organisms, you ever see the word GMO, that stands for genetically modified organism, are kind of new to our society, to the world. They've been invented in a laboratory. And so they've been around long enough now for studies to start to come out to show that they're not benign, that they do have adverse health effects. And where do you find genetically modified foods? Well, not just in corn oil and soy oil. Let me get my numbers right here. I think it's 94% of all soy and 92% of all corn in this country is genetically modified. That's a lot. So chances are if you're doing corn oil or soy oil, it's genetically modified. And whenever you process anything, even if it's avocado oil or olive oil, too much of the processing causes problems. So I don't like the fact that the ketogenic diet is saying eat as much fat as you want and you'll lose weight. You will, by the way. If you do the ketogenic diet, you will lose weight. However, long-term side effects are people are eating not just good fats, but bad fats. And if you're eating these polyunsaturated fats, they can oxidize. You absorb these oxidized oils. Oxidized means it starts to break down. It goes rancid. That's a good word you might get. So what happens is it enters into the bloodstream and it comes in contact with something called the endothelial cells. There's 62,000 miles of blood vessels in your body. 62,000 miles of blood vessels in your body. That's a lot of space, a lot of endothelial cells, a lot of places where things can go wrong. And so these oxidized oils, the rancid oils, get into the endothelial cells and they irritate the endothelial cells. So they can oxidize outside the body, but it can also oxidize inside the blood vessel if you have a diet that's high in something called free radicals. Now, I'm going to get a little technical here, so just bear with me. It'll come to you. So free radicals are like Pac-Man. They eat through things. And so when a free radical attacks a cell, it can literally start to tear apart the cell and damage the cell wall. And that could cause some real serious damage. Free radicals can also oxidize the fats. These oxidized fats get into the endothelial cells, the lining of the wall, endothelial, and that can cause some problems. So where else can we get free radicals from? Infections, exposure to toxic substances, bad diet, cigarette smoking, chemicals, car exhaust. How about just everyday life? You produce free radicals. Part of your life is you're producing free radicals every day. And if we have enough antioxidants to fight off the free radicals, the body stays healthy. When the free radicals start to overtake the amount of antioxidants there are, now what are antioxidants? Antioxidants attack the bad guys. So this is the free radical. It's coming in like Pac-Man, waka, 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 waka. And the antioxidant stops that Pac-Man from doing damage. So the free radicals, Pac-Man, antioxidants, good guys beating up Pac-Man. Bad diet. How many people eat fried food? Raise your hands. How many people eat coffee? Raise your hands. How many people eat cooked food? Raise your hands. All these things can produce free radicals, and that can cause rancidity or oxidation of these polyunsaturated fats. So oxidized oils affect the body in two ways. They enter into the wall of the blood vessel, they infiltrate below the endothelial cell, and they can trigger an immune reaction. So what that means is you have this foreign body getting into the endothelial cells. The immune system says, hey, what are you doing here? Get out of here. And they attack, and because they think it's an invader. That in turn triggers inflammation at the site where the oxidized oil entered into the blood vessel. Unoxidized oil and cholesterol cannot enter the blood vessel wall. Only the oxidized oils can. So the cholesterol floating around in the blood you got to keep that in check. I don't have a problem with that, but that's not really the ones we're worried about. We're worried about the ones that are causing damage into the cells. And there's high density lipoproteins and there's low density lipoproteins. I'm going to cover this again later on, but this is a very important statement. The low density lipoproteins oxidize or go rancid easier than the high density lipoproteins. So the low density lipoproteins can oxidize, and then they start to infiltrate or dig into the endothelial cells, and they cause an inflammatory reaction, and the body attacks it. I've done a lot of shows on inflammation. And inflammation is going to be the key here. And it was funny, I was just before now I was talking to my boss here, and he said, it's fascinating because my boss predicted, he says, everything you talk about will come true in 10 years. And I said, well, it has come true from the things I talked about 10 years ago and 20 years ago. So he says, this is going to be mainstream nutrition, what you're teaching right now. And I'm convinced of that. And I said, good for you, Pete. I appreciate that. But it's true. The things we talked about, I talked about hydrogenated oils years ago and how dangerous they were. And then one day I get a phone call from my mother, and she said, I just saw a story on CNN, and they said that margarine, hydrogenated oil, is the number one cause of heart disease. Why? Because it's an oxidized, rancid, goes rancid fat. And she said, I'm not sure if you're a nut or a prophet. I haven't figured it out yet. And I said, that's okay. It's probably a little bit of both. But the things we talk about today, I promise you, this is cutting edge. Nobody else is giving you this stuff. The cutting edge information is what you need because you want to beat the crowds, because it may be too late if you don't beat the crowds. So inflammation occurs in the artery wall, and that causes the problem. Immune reaction attracts white blood cells called T lymphocytes and macrophages, and that's where they start attacking. Those are the blob. They attack and gobble up the bad guys. Macrophages are the main white blood cell involved in arteriosclerosis, hardening of the arteries. So it's an inflammatory reaction that causes this swelling, that causes the body to lay down. We're going to talk about this plaque, and that's where the hardening of the arteries comes in. So macrophages gobble up the oxidized oils, and then they can release harmful molecules that help create the plaque, and that's what leads to the heart attack. So that's the mechanism of how you get the hardening of the arteries. What does it boil down to again? Bad foods, keeps coming back to diet. I don't know anyone who eats a plant-based diet who has these problems, ever. I get my blood checked all the time. I had full body scans done. In the Atlanta area, there's a company that does full body scans. And I went in there, and they were going to just do my heart. And they said, wait a minute, you're Dr. Joe. And I said, yeah. He goes, you're the guy on radio. I said, yeah. You're the guy on television. I said, yeah. They said, we're going to do a whole body scan for you. Did a whole body scan, perfectly clear, 100% zero plaque. And at my age, there's only a small percentage of people that have that. And everyone I've ever known that had zero plaque at my age eats a good diet. Everyone I've known who eats a bad diet has plaque in their arteries. Across the board. Just is what it is. So why would you do something that's going to cause problems when you don't have to? Now, I'm a chiropractor. I'm board certified in chiropractic, orthopedics, pain management, double board certified in nutrition, BS in nutrition, retired dietitian, award-winning author. And so when we talk about health, we want to get the nervous system working properly. We want to get the digestive system working properly. Today, we're talking about the circulatory system. And we want to make sure you have a good diet. And if you can do those things, and a good diet helps the circulatory system, so that's how it ties in. If you can get the nervous system, digestive system, and diet straightened out, it's pretty powerful stuff. And I think you're going to be very happy with those decisions. The only downside, I'll be honest, I've been doing this for 30 plus years now. The only downside of eating a plant-based diet is that the stuff that I remember tastes so good are not part of it. Meatball sandwiches, double beef cheese hamburgers. It's really about the only two things I really can think about that I really miss a lot. Because years ago, if you went to a plant-based diet, you were just eating salad. That was it. You're eating salad and you're stuck. However, now there's so many options. Most restaurants, I did a show on this a while ago, most restaurants have a plant-based, at least one option. Or they can create one if you ask. And that's the cool part. You may look at, like I've been to a steakhouse. I remember going to a steakhouse a while ago with all my friends, and they were all meat eaters. And I thought, well, what am I going to eat at a steakhouse? So I'm going for the camaraderie. I'm going to hang out with my guys, a guys' night out. And I looked at the menu and I thought, there's steak and there's fish and there's chicken and there's more steak and there's more hamburgers, and I didn't know what to do. So I went down, I looked at the side orders. And there was baked potatoes and there was broccoli and there was mushrooms and there was Brussels sprouts. And I've been to 2 dinners recently because I get invited to a lot of dinners by health professionals. Because everybody wants my referrals, and of course I want their referrals, and so we work back and forth together. And many times I'll have a dinner inviting the other doctors at a fancy restaurant. It's got to be high-end in an open bar. And both times in the past couple of weeks that I got invited, I said, I'm a vegan. And both times they said, we got it handled. That was it. They brought back this amazing, one place was asparagus, Brussels sprouts, I can't even remember now. Squash, mushrooms, huge plate, spinach, huge plates. Everybody at the table, wow, that looks great. They had a little piece of steak, the size of the palm of their hand. So they ate and I ate. And at the end of the meal, they were full and I was full. I even had leftovers. At the end of that meal, they felt heavy and bloated and, I'm so tired, I got to go home. I felt great. So yes, the flavor may not have been that of a prime rib. I mean, grilled asparagus is good, but it can only be so good. But the thing is that you can do this. And when you do it, I promise you, the payoff is amazing. And you'll say, like so many of my other patients have said over the years, why haven't I done this sooner? Why haven't I listened to you, Dr. Joe? And almost every time we do a show, we have call-ins. People call up, say, Dr. Joe, I've been listening to you for 2 years, 5 years, 10 years, 20 years, whatever it is, and say, you're blowing my mind. And I did what you said, and I can't thank you enough. Had a guy call in last week, lost, 35 pounds in a very short period of time. He's off all his medication except his thyroid medication. His digestion is better. He says, I'm sleeping at night. He says, I look good. I'm starting to date again. He says, I can't thank you enough for all you've done. He's never even met us. Just listens to the shows. And part of that is I always make sure people are on supplements, because I take supplements every single day, and I think you should too. And the minimum amount of nutrients you need, I create a supplement called Dr. Joe's Super Greens and Dr. Joe's Essential Source. And they're 2 powders. I mix them with coconut milk, ramen milk, or cold water, shake it up and drink it at least once a day. And that's the minimum amount of nutrients you need. And it alkalizes your system. And it gives you things like iodine that most supplements don't give you, because iodine is necessary not just for your thyroid, but for all the organs in the body. And so if you're going to do any supplement, if you're willing to take step 1, because people call up and say, Dr. Joe, what's step 1? Give me step 1 into getting healthy. I want to do it. I'm sick and tired of being sick and tired. At least Dr. Joe's Super Greens and Dr. Joe's Essential Source. I also take B vitamins. I take adrenal support because as I get older, my adrenal glands are getting older. They produce my sex hormones along with my sex organs. And so I want to make sure all my organs are healthy and producing the hormones that they need to be. In the winter, I take vitamin D3. I take 5,000 international units of vitamin D3. All of those supplements, we have Dr. Joe versions of them. They're on the website, drjoe.com. So if you're ready to get well, at least the Super Green is the essential source, but I would do a whole more than that. But I figured I'm going to start out slow with you. I'm going to hold your hand. We're going to take little baby steps. But I used to date a girl, and she had a great line. She said, moderation is for monks. She wanted to live an extreme life. And that's what I want for you. I want you to have extreme health. I don't want you to have moderate health. I want you to have extreme health. And when you get to that level, you'll never go back. And that's what's so cool about it. And you'll think about meatball sandwiches and go, yeah, they are pretty good, but boy, it's not worth it. I'm not willing to give up a whole afternoon or a whole day, or I can't sleep or get constipated or whatever it is because I felt like a meatball sandwich. It's not worth it. And that's what I have to do. I have to give you the trade-off. What's more valuable, your health or a metaphorical meatball sandwich? And the answer is once you experience it, your health is worth it. I promise you. If I'm wrong, I'm wrong. So what? I lied to you. I'm not lying to you, though. If you'd like to come see us from a chiropractic standpoint, from a nutrition standpoint, if you have digestive issues, acid reflux, heartburn, my team of doctors and I, we'd love to be your doctors. So if you want to make an appointment, go to my website, drjoe.com. Now, in the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. So we would love the opportunity to meet with you, and you'll say, like so many other patients say, why did I suffer so long? Why did I suffer needlessly? And why didn't I do this sooner? I hear it not every day, every hour, probably more than that even. I get emails, I get phone calls, I get messages through the website, drjoe.com, people taking the supplements. They're pretty happy with the whole thing. So I'm trying to make it as easy and inexpensive as possible for you. That's been my life ambition, is to make health so easy and so accessible. So go to my website, drjoe.com, and start doing that. Now, the reason that ties in today's talk, which is heart disease is not just for old people anymore, is that the Super Greens, the essential source, are loaded with antioxidants. Because if you listened earlier, free radicals, oxidized fats, are eating away at your blood vessels. Low-density lipoproteins can easily be oxidized if there's a lot of free radicals around. So we got to make sure that we have enough of these antioxidants, these nutrients that can help neutralize the free radicals. And Super Green is an essential source loaded with antioxidants. And when you have this oxidation or this breakdown, if you have free radicals, it can eat away at your skin, cause wrinkles. Smokers look like smokers, right? They get the wrinkly face and everything. 100 trillion free radicals per puff of cigarette. And now people are saying, well, Dr. Joe, smoking pot's okay because it helps with certain things. No, because it's still a smoke. And if you're blowing smoke into your lungs, I don't care if it's from a campfire. I mean, of course, cigarettes and marijuana are worse because with marijuana, you smoke it, you hold it in your lungs longer. It's causing more free radical damage. So politically, I don't care what your views are. If you're blowing smoke down your lungs, regardless of what it is, it's not going to be good for you. And if you hold it there longer, it's even worse. So we really want to stay away from smoke and chemicals and toxins and car exhaust. They're not good for you. They're creating free radicals, which can cause problems. So back to the oils again. What happens is, since the 1700s, pathologists looked at plaque in the arteries, and I've done this, I've cut open dead people, and it looks like bubbles or boils inside the blood vessels. And they're inflamed, and that's why they call it a boil. Now, boil on your skin, the body tries to wall off the pus and keep it contained. That's what's happening in the body. You're having this reaction, this inflammatory reaction, where the body is now laying down plaque to kind of wall off and isolate this inflammatory reaction. Maybe look at it like a scab to make it simple and easy for you. So what happens is this inflammation occurs, and if it's stable, it's probably okay. You may have it. We probably all have it all the time, and the body does it, and it heals. Some plaques fail to encase the inflammation, and that's when that fibrous cap can break down, and the toxic waste products can get into the blood, and this plaque can cause more irritation. The waste products can cause more irritation and more plaque. And as the oil or this toxic contents are there in the blood system, the body starts to coagulate blood around it. And that's how we start to block off the arteries. And so now you can't get good blood flow through it. So when it occurs in an artery supply to the blood, artery supply to the heart, it's a heart attack. If it happens in the brain, we call it a stroke. And so, once again, heart attacks and strokes are not just for old people anymore. It's becoming fashionable with the young kids. It's not a good thing. So anything can produce free radicals. Infections. You can have an obvious infection, right? You can have a cut. You can have an infection. You can have irritable bowel syndrome, which can cause an inflammatory reaction. You can also have what we call subclinical or hidden infections. So, for example, if you have dental work and you have a root canal and they put in a metal screw to hold the tooth in, which I have, by the way, that creates a chronic infection forever. Because what they do is they clean out, they pull out the tooth and they wash it all out, but you've got these little canals that are off the sides of the canal. And bacteria, anaerobic bacteria, can live in there. And they live in there, they're very happy, and you have this ongoing low-grade infection. Some people, it's more reactive than others. So I wish, and I'm not a dentist, but knowing what I know, I wish I had never gotten a root canal. I wish I'd just gotten a bridge. And then I could take it out, clean it, and put it back in again. So I'm not a big fan of these things because we are finding now they do cause chronic long-term infections. I don't think anybody argues that point. And so that can cause a systemic inflammatory reaction. Autoimmune diseases. How about lupus? How about rheumatoid arthritis? The body is attacking itself. The immune system has gone awry. It doesn't know what to attack and what not to attack, so it starts attacking itself. And that can cause an inflammatory reaction. Exposure to pesticides and herbicides, toxic chemicals. One of the big companies just got sued, and they lost a lawsuit for, was it $930 million? I can't remember the exact number now. And only a portion of that was going to the person who got damaged. Most of that was fines. Of those hundreds of millions of dollars, most of that was fines to the company because they supposedly knew there were issues and didn't report them. And so now we're finding that what we thought was safe was not. Remember DDT? Anybody old enough to remember DDT? It's perfectly safe. It's great. It's a pesticide. We can use it. Turns out that it causes birth defects. We had to pull it off the market. Well, now glyphosate came in. And glyphosate was the end-all, be-all. Man, you spray it on a weed, that weed is dead, and this stuff works. You spray it on anything, that thing is dead. Well, now it turns out that the glyphosate is causing problems, and it can kill bacteria in your colon. Aside from the other problems, it can act like an antibiotic and kill off the good, healthy bacteria in your colon. And that's why if you read the label, it clearly says spray downwind, don't let your kids on it, don't let your dogs on it. But some people who work in the landscaping business spray this stuff for a living. And if you ever saw how your food is sprayed, if you ever watch the people, if they spray the food, if they spray the pesticides on your food, or the herbicides kills plants and pesticides kill bugs, they wear a hazmat suit from top to bottom, and then they spray it. So be careful with your pesticides, folks, and be careful with your herbicides because there can be long-term effects. If you do spray them, take your shoes, your pants, wash them right away, hot water. Make sure you wash them off your clothes, wash your body, take a bath afterwards, wash your hair. Don't go to bed because you put your head on the pillow. It has pesticides on it. You keep breathing it all night. There's a Moody Blues song. And a line from the song is, and I'm frightened for your children. And the life that we are living is in vain, and the sunshine we've been waiting for is turned to rain. But the line, I'm frightened for your children, that has a big impact on me. It plays in my head a lot. Because the things we're told were safe now aren't. How many medications have been pulled off the market? They were told they were safe and they're not. How many pesticides have been pulled off the market, told they were safe and they're not? I'm not against drugs. I'm not against surgery. Please understand that. But if there's a way to get well without the drugs and the surgery, that's what I want you to consider. So by changing your diet, going to a more plant-based diet, that's something that's obvious for so many different things, including hardening of the arteries, getting those antioxidant levels up, cutting out those free radicals, cutting out the polyunsaturated, oxidized oils, fried foods, oil when it's heated at a high temperature, that creates these free radicals. Cut those out of your diet. And if you don't know what to eat, go to my website, drjoe.com, and I have a video there. And there's two things. One says SoundCloud. Those are downloadable. Those are audio. And then we have the Dr. Joe Show, which are audio and video, and that's on YouTube. And you can watch my first lecture. It's called The 7 Deadly Sins of Nutrition. We also have an audio lecture on the YouTube channel and on SoundCloud called So What Can I Eat? Tells you what not to eat, tells you what to eat. Minimum amount of nutrients, super greens and essential source. Minimum. That's absolute positively bare bones. And it's relatively inexpensive. It's only a couple of dollars a day. I mean, you can afford that if you cut out some of your bad foods. And then I take B vitamins. Nitric oxide increases circulation. If you have a circulatory issue, I like to take nitric oxide. It helps brain function. It helps other function. It's a family show. We'll keep it clean here, but circulation becomes an issue as men and women get older. This helps increase circulation. So nitric oxide is great. If you're on blood pressure medication, be careful because it can open up your blood vessels and your blood pressure can drop. So if you're taking medication, monitor yourself. And if you go too low, you either got to give up the healthy stuff or give up the medication. Don't give up the medication without your doctor's permission. Always check with your doctor when it comes to medication. If you want to make an appointment to come see us, we have chiropractic offices in Marietta, Duluth, and Stockbridge. If you have neck pain, back pain, shoulder pain, numbness, tingling, acid reflux, many times we have to adjust the stomach to pull the stomach away from the diaphragm, go to my website and make an appointment, drjoe.com. Stop suffering. So many people suffer and they don't know why. When they finally come in, they're so happy that they did. No guarantees, no promises, but after 34 years of doing this, we're getting pretty good at it. Folks, thanks for listening. Tell your friends about the show. We'll catch you next time. Thanks for listening to For the Health Bit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.